Good afternoon, everyone. I should say hello to online my friends, Professor Mingguang He, and my friends also, Professor Gongwei and Sike, together, all my colleagues. And here it's my great pleasure to introduce our work of digital ophthalmology artificial intelligence exploration. I'm Juan Ye from Department of Ophthalmology, the second affiliated hospital of Zhejiang University. With the development of people's living standards, eye disorders, especially vision-threatening disease, have received more and more attention, including diabetic retinopathy, age-related macular degeneration, glaucoma, and other eye disease. As we can see in these pictures, patients' vision quality will be substantially affected by these conditions. Early detection, diagnosis, and treatment are very important to improving the life quality and the prognosis of patients. With the rapid development of artificial intelligence, AI has obtained a series of achievements in the ophthalmology. Today, clinical translation gradually comes into reality. In 2016, a deep learning system for diabetic retinopathy screening and grading was published in JAMA. Subsequently, FDA permits approved IDEX-DR, diabetic retinopathy screening software, which is currently the only FDA-certified AI software. In 2017, JAMA published an article from Professor Daniel Tin. Daniel Tin is online now. Daniel Tin's team, a multiple eye disease diagnosis system based on deep learning, including diabetic retinopathy, AMD, and glaucoma. Subsequently, in 2018, the Cell Cover article published a study of AI system that simultaneously assists in the diagnosis of eye disease and pneumonia using transfer learning. Last year, Nature Medicine published an article using deep learning to predict the progression of exudative AMD, demonstrating the potential of AI in predicting disease progression. Our research group, my students, some of my students are here. We began our AI exploring 10 years ago, established 3 major platforms facilitating our research. Clinically, our eye center, Clinically, our center has a large number of patients and advanced equipment while accumulating data from domestic and foreign multi-centers through the ophthalmologist labeling, finally set up a standardized database. In engineering platform, we received long-term and stable support from the National Key Laboratory of Computer Science Department of Zhejiang University and also Real Doctor Research Center of Zhejiang University. As to the Translation Institute of Translational Medicine of Zhejiang University, bridges the basic and clinical medicine and promotes the clinical translation. Next, I will share our recent work in AI ophthalmology from 3 aspects: standardized database establishments, first, and AI-assisted diagnosis and AI-assisted treatment decision-making. First, we established a standard retinal image database via the development of image quality assessment based on human vision system. Related work has been published on top journal of medical imaging, and also we got authorized patents. Then we enhanced the images of low quality images to help doctors diagnose retinal disease more accuracy. Related work, as you see, we also have the published work in the top journal. Through the preliminary data standardization, we utilize our self-developed interactive labeling software to improve annotating efficiency, save doctors time, and finally, we established a standard database. And these are the serial achievements of standardized database building. We published a paper and some software copyrights. Based on the establishment of standardized database, we have conducted a series of studies on AI-assisted diagnosis. Firstly, we proposed a deep learning system for the automatic diagnosis of AMT use OCT images, significantly increasing the accuracy of AMD diagnosis. Then, on the basis of a feature-level fusion of OCT and OCTA, a deep learning system capable of distinguishing the activity of AMD was proposed. Furthermore, we realized the automatic identification of eyelid malignant melanoma in pathological slides using deep learning, helping doctors make better diagnosis, because we are oculoplastic surgeon, so we have patients of the eyelid tumor, orbital tumor, so we have these samples, and also we collected the slides to do some AI diagnosis. We have also conducted experiments on automatic detection and measurement of ptosis using AI, aiming to facilitate doctors' pre- and post-operative evaluation. Related work were published on SCI journals, and also we are pleased to get authorized patent and software copyright. And these are the serial achievements, the publication, and some software copyright of AI, the second part, AI-assisted disease diagnosis. The last part I'm going to introduce is we focus on the construction of treatment decision-making AI system. Our aim is to try our best to using AI for doctors, for patients, and for clinical work. First, we proposed a system for automatic detection of leakage points in central serous chorioretinopathy from fundus fluorescence angiography based on time sequence deep learning, which shows potential application to guide laser therapy. Related work was published in the typical collection of breakthroughs in artificial intelligence for ophthalmology in graphics. And also, the peer review comment was solve the current problem of false positive in AI. This publication, though the IF is not so high, but the comments is very exciting. It's my students' work and our research group work. In addition, our AI system automatically identified non-perfusion areas in diabetic macular edema and assisted in the design of laser paths. These are the achievements of our research in AI-assisted treatment decision-making. And to summarize, along the above 3 levels, our team has conducted a number of ophthalmic artificial intelligence research. In the future, we plan to build a clinical diagnosis and treatment system that integrates both software and hardware. We suppose the system will be capable of comprehensively elevating the level of diagnosis and treatment for multiple perspectives, including knowledge framework, data processing, theoretical interpretation, platform construction, and precise treatment. Furthermore, we aim to establish an internationally leading platform for technology development and industrial translation, and we believe the upcoming digital medicine industrial chain will change the landscape of future medicine. Thank you for listening.